Did you know that there is a way to help heal most L5-S1 disc herniations that does not require drugs, surgery, or endless frustration? If you're tired of living with sharp, radiating low back pain and/or leg pain, you are not alone and there is hope. In this video, you will learn there is a therapy that has been clinically shown to help reduce the size of disc herniations, reduce the severity of pain, and help as many as 80% of cases avoid surgery. I'm going to break it all down for you. I'm going to show you how computerized spinal traction decompression therapy works, where to find this amazing therapy, and why it is one of the safest and most effective non-surgical treatments out there for L5-S1 disc herniations. I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. I designed this channel to help you improve your posture and spinal health so that way you can feel better, move better, perform better, and have overall improved health. Before I dive in, take a moment to subscribe to this channel if you do want to improve your posture and spinal alignment so you can feel better, move better, perform better, and have overall improved health. Non-surgical spinal traction and decompression therapy is a highly effective treatment that works by decreasing the pressure in the herniated disc. Essentially, it does this by creating a stretching and relaxation movement within the spinal segments that the treatment targets. This produces a negative pressure effect in the herniated disc. This negative pressure has two major effects. Number one, it actually helps to pull in herniated disc material. And number two, it helps to facilitate the flow of fresh nutrients into the disc, and it helps to pump out waste products, which can encourage a healing environment within the disc by helping cells that do the repair work to migrate to the site of injury. Non-surgical spinal traction and decompression therapy is supported by clinical research. In a study published in the journal Neurosurgery, they found that this therapy was successful in significantly reducing the intradiscal pressure. This is the mechanism that suggests how these discs often heal when undergoing this type of therapy. This therapy is performed on a very specialized table. The patient is lying on their back with large bolsters under the knees, which helps the hips to flex. That helps to take a lot of pressure off of the low back region. Gentle straps are applied to the pelvis and one under the arm so we can direct where we want the gentle pulling or traction force to occur. This traction force typically is held for 45 seconds, and then there's a relaxation phase that lasts about 15 seconds. The combination of those movements over the span of about a 15-minute treatment time allows for that gentle pumping action in the disc, which can help the negative pressure achieve those two key effects that we talked about a moment ago. Because the pain from L5-S1 disc herniations can be so severe, many people feel like they really don't have much hope. Painkillers frequently don't work. Injections don't work. Really, the tissue's damaged and it's under a significant load. So many people are told that surgery is their only option. But the good news is, what many people don't know, and many doctors do not know, is that even despite the severity of pain, the research shows no matter how severe that disc herniation looks, even if it's large on an MRI, up to 80% of cases can heal to the point where people can return to full function without pain, without needing surgery, if they are able to get access to conservative treatments such as non-surgical spinal traction and decompression therapy. What makes an L5-S1 disc herniation so difficult to treat is due to its location. As you can see, the L5-S1 disc is right here, so that's at the very base of the spine. It's under the most amount of compressive forces every single day. The largest force that we have to deal with when we are upright, sitting, standing, walking, is the force of gravity. As we say, gravity wins 10 out of 10 times, and the lower you go in the spine, the more of a load is placed upon each successive level that you drop. So here are 3 steps on how to get started with spinal traction decompression therapy. Step number 1, find the right clinic. You've got to go online, you've got to take some time searching, You got to look for clinics that have non-surgical spinal decompression traction therapy. We suggest looking for clinics that have brands such as the Chattanooga traction decompression tables, or like we use here in our clinic, the Dynatron DX2 traction and decompression tables. Make sure the provider at the clinic you find is experienced with treating herniated discs. Step number 2, commit to the process. All healing takes time, and herniated discs, when they heal, there's no exception. What the research shows is it can take as many as 20 sessions, spinal traction decompression therapy, before that disc heals enough to the point where a full recovery is possible. Oftentimes, this can take 6 to 8 weeks. So just like athletes that have herniated discs, they're not back in the field for 1 or 2 days. They're typically on the DL for a good 30 days or more. So 6 to 8 weeks, and commit to the process. Number 3, safety first. Although this therapy is highly effective and incredibly safe, there are some conditions where contraindications exist, and these individuals unfortunately cannot safely undergo non-surgical computerized traction spinal decompression therapy. Some of these conditions are fractures, obviously. If someone is pregnant, they cannot undergo such care. If there are spinal infections present, those are the top 3. A few more exist as well. So that's something that if you find a clinic in your area, that discussion needs to be had with the provider there. Also, prior to undergoing any non-surgical traction decompression therapy, a thorough exam needs to be undertaken so that way that the provider and the patient knows that they truly are a fit for this therapy. If you are wondering about the benefits of non-surgical spinal traction decompression therapy, well, number 1, the results speak for themselves, but here are some major bullet points. Up to 80% of all herniated discs should heal with this type of conservative therapy. Number 2, patients often feel immediate, significant relief while they're on the table and the traction is applied. This often is the first time where the pressure is actually reduced in the disc, and nerves that are being hammered by that disc material are actually getting a break. It is not unusual for patients that have been suffering with severe pain to even fall asleep during their traction sessions. And lastly, number 3, spinal traction decompression therapy is a non-invasive, drug-free, surgery-free option that can help many discs actually heal and recover. If you are ready to take the next step, do not wait. Right now, go online, research, find a clinic near you that has non-surgical spinal traction decompression therapy. You do not have to live with pain, and there's a good chance you will not need surgery. If you found this video helpful, please like it and share it with anyone else that you feel may benefit from watching it. The next video you should absolutely watch is how to fix the underlying cause of L5-S1 disc herniations. Click here to watch it now, and I'll see you there.